The topic is protein binding drugs. This topic is covered by our previous video. Next topic is mechanism of protein binding drug. Now the topic is mechanism of protein binding drug. Binding of drug to protein is generally reversible, which suggests that it generally involves weak chemical bonds such as hydrogen bonding, hydrophobic bonding, ionic bond, van der Waals bond force. Irreversible drug binding through a rare arise as a result of covalent binding and is often a reason for the carcinogenicity or tissue toxicity of the drug. For example, covalent binding of chloroform and paracetamol metabolite to liver result in hepatotoxicity. Binding of drug fall into two classes: binding of drug to blood component like plasma protein, blood cells, binding of drug to extracellular tissue, protein, fat, bone, etc. The influence of binding on drug disposition and clinical response is shown in figure 4.1. These are the figure protein binding drug. Figure protein binding drug, binding of drug to various tissue component and its influence on disposition and clinical response. Note that only the unbound drug move reversibly between the compartment. Of all type of binding, the plasma protein drug binding is the most significant and most widely studied. Binding of drug to blood component, plasma protein drug binding. Following entry of drug into the systemic circulation, the first thing with which it interact are blood compartment like plasma protein, blood cells. Okay, this binding of drug to the blood component will cover on next video.